We're gonna start with our first speaker of the day. Um, I'm happy to introduce Laura Luna Bellucci, the Bureau Chief for the Bureau of Women's and Children's Health. She's within the Arizona Maternal Child Health Director position. She also serves as the state's Children with Special Healthcare Needs Director and has represented Arizona Department of Health Services on several external committees. She has more than 15 years of experience in public health with progressively responsible positions overseeing programs that serve both children and families. Laura has been part of the Bureau for Women and Children's Health since 2011. She started off as a teen pregnancy prevention program manager and then progressed into a child and family health manager and also served as the maternal infant early childhood home visiting program director. As you can see, she's worn many hats. In her previous role, Laura served as the office chief of the Office of Children's Health within the Bureau, overseeing several programs and more than $16 million in state and federal funding. She has a master's of business administration and has completed several leadership programs, including the Leaders Across Borders program, Maternal and Child Health Public Health Leadership Institute, and Valley Leadership. Prior to her work at ADHS, Laura spent more than 11 years at Chicanos por la Casa as the Prevention Services Coordinator. Please help me in welcoming Laura as she presents to us this morning.
Thank you so much, Corey. I really appreciate that introduction, and really thank you to the MCH Translational Research Team for the invitation to be able to participate in this meeting and share a little bit about our Arizona Maternal and Child Health Title V Block Grant. So as Corey mentioned, my name is Laura. I am the Chief of the Bureau of Women's and Children's Health. I'm also in this role as Bureau Chief. I serve as the Maternal and Child Health and Children with Special Healthcare Needs Director. Both of those roles are very specific to the Title V Block Grant, and each state does have those positions outlined as individuals that help move forward the Title V work in each state. So in my remarks today, specifically, I'll be summarizing the state Title V program, specifically today the components of the Arizona Needs Assessment process and how they tie to the work and the priorities. Also, how Arizona moves from our needs assessment to action plan. Also briefly share our MCH priorities that are currently in place for our 2021 through 2025 5-year state plan, and share some of the recent campaigns and initiatives specifically focused on mental health, since I know that is a topic for this group and this conference today. Next slide. So here are the objectives. As a result of our time together, I hope to be able to demonstrate that individuals will walk away with a understanding, basic understanding of our Title V Block Grant and how it is used, be able to describe current MCH-focused initiatives in our state, and identify current MCH-focused mental health initiatives. Thank you. Next slide. All right, to start us off, it really is just to focus a little bit on the background and the establishment of a Title V and what that means. So what is Title V? It was established in 1935 as part of the Social Security Act. It is 88 years old, so this is a legislative act that has been in place for quite some time and has funded specifically maternal and child health efforts across the nation. Title V remains the longest lasting social and public health legislation in our nation's history. The Title V MCH Block Grant, as we call it for short, and other jurisdictions use this federal funding from federal funder HRSA, the Health Services Administration, to improve the health and well-being of women, infants, children, and adolescents, including children with special healthcare needs. and their families. The individual state allotments, are determined by a formula. And so this is considering the proportion of low-income children in a particular state compared to the total number of low-income children in the entire US. So using that formula, the federal government is able to calculate the allotments for each state. And in Arizona, we do have an allotment of $7.4 million as our allotment for federal funding. This funding is important to note that there is a match requirement that includes a $3 match in non-federal funds for every $4 of the federal MCH block grants that are received. So our total investment in combination of our state non-Title V funded and our Title V funded activities totals to about a $19.8 million investment in Arizona families per year. Next slide. So briefly wanted to touch on these 6 components. So the Title V block grant is organized in focusing 6 population health domains. These population health domains are how the work is distributed and organized across the life course and across our families within the state of Arizona. And so we have the women and maternal health population health domain. This domain we focus on women ages 18 to 44, before, during, and beyond pregnancy, and across the life course. The perinatal infant domain, focusing on infants during the time surrounding birth, particularly 3 months before and 1 year after. The child health domain, children 1 to 10 years of age. Our children and youth with special health care needs domain, obviously specifically focusing on children and youth with a diverse range of needs, anywhere from behavioral and emotional conditions, chronic conditions, or medically complex health issues. Our adolescent health domain, young people ages 11 to 21 years of age. And then the cross-cutting and systems building is the 6th domain. Really, these are any cross-cutting MCH related services or activities. For example, oral health. Oral health care can be found or is labeled as a cross-cutting activity because it can fall under each of the other Title V population health domains. Also access to care, insurance coverage, those are other areas that are cross-cutting and impact each of the population health domains and help us to build systems. Next slide. So a little bit, I'm going to touch a little bit on the Title V needs assessment and the process that Arizona uses. So through Title V block grant funding, states have the opportunity to develop, enhance, and assure access to quality healthcare to support a very robust statewide maternal and child health system. The Title V block grant is administered by the Department of Health Services and is a critical partner in helping mothers, children, families across the state. So as part of the Title V legislation, each state is required to transmit a comprehensive needs assessment and collaborate with community partners to do so every 5 years, with the purpose of identifying the need for preventative and primary care services for pregnant women, mothers, and infants to age 1, preventative and primary care services for children, and services for children with special health care needs. This is a very data-driven process. The diagrams that I have on this slide here really just show the coordination and the planning steps that our Title V needs assessment team, led by Martine Salaya, and our epidemiologists and tribal partners to move forward in this data collection process and in collaboration with other state partners. So through this experience, the state is able to determine its priorities, develop a 5-year state action plan, target funds to fund those priorities, and report annually on progress. I just really wanted to also share that Arizona's team for the Title V needs assessment includes the MCH director, which is the role that I play, the Bureau of Assessment and Evaluation, which is our Bureau Chief Martine Salaya, and also our Title V Block Grants Program Manager, Ashley Neves. This is made up of the core team, but we also have our very important Title V Needs Assessment Steering Committee. This is made up of all external stakeholders, about 35 nominated individuals based on the experience and expertise working with those MCH priorities, specifically within those population health domains or in those cross-cutting and access to care domains that I mentioned in an earlier slide. So these individuals help throughout the process in that needs assessment planning and coordination and serve as key individuals in informing that process. The Title V Needs Assessment Implementation Team is made up of our Arizona Department of Health epidemiologist team, our tribal epidemiologist partners, and state contracted partners to be able to carry out the work and implement all of the components. So really the assessment plan, design, coordination, and the final product is a Title V Needs Assessment Report, which at the bottom right, I've included a link, and if this information will be shared, will be made accessible to each of you to be able to view. We are currently in the process of beginning to plan for our upcoming needs assessment that will be able to cover those priorities for 2025 through 2030. So it's hard to think about that far ahead, but starting actually Friday is our first Title V Needs Assessment Steering Committee meeting. So we are moving along. Next slide. So next, I want to highlight how Arizona moves from needs assessment to action. So what does it look like after the needs assessment information has been collected, the data has been put together, then the state in particular puts together what's called our state action plan, which outlines the priorities for that 5-year time frame. Here is Arizona's statewide MCH priorities as a result of the findings from our 2020 needs assessment. This is our current plan, and the priorities are organized by population health domain, and they link to the national performance metrics that we call NPM for short. Is a term that is used within the block grant. So that NPM means National Performance Measure. These priorities, in a lot of ways, are a continuation of interventions and strategies that have been the focus of Arizona's Title V block grant and the work within the state of Arizona for some time. We did, however, renew our plan to reflect the information gathered during our needs assessment process, specifically to include and explicitly emphasize health equity and quality of service provision. For this reason, we included terms such as equitable and optimal in the framing of our priorities. Also on the far left, you'll see family engagement is also one of the core new priorities as it is a mechanism through which health equity can be achieved. Just wanted to comment that there are a total of 15 national performance measures that each state can select from. And these NPMs are selected and categorized by population health domain, and they help to guide the selected strategies that are a part of the activities and services carried out by our program partners, contractors, and ADHS teams. Next slide. So I wanted to highlight the state-specific strategies that are tied to mental health. Another term that we use quite often as part of the Title V block grant is ESM. This stands for Evidence-Based or Informed Strategy Measure. Each state is required also to tie and create state-specific actionable strategies. And these ESMs are developed by Arizona's Title V program core team and are informed by the Title V block grant needs assessment to identify the program strategies and activities that will impact the population health domain and help to move the needle on the national performance measure. So we have some of these strategies for each of our national performance measure, but in this specific presentation today, I will be highlighting those that are mental health related strategies and ESMs. So as you can see here, within our women's health domain, we have a strategy where we are tracking the % of mothers that are enrolled in home visiting programs who received a postpartum visit with a healthcare provider within 60 days of delivery. the number of times home visitors access a maternal mental health consult for their clients. In our population health domain for children, we're tracking the percent of children enrolled in home visiting who receive a referral for developmental services and have a completed referral. Next, the number of providers that receive developmental screening training and the percent of providers that receive developmental screening training who report initiating screenings with parents in their practice. We also have in our population health domain perinatal infant mental health strategies that also help us track the number of home visitors trained to receive who receive a lactation counseling or breastfeeding support certification over the next 5 years, looking to increase the percent of home visitors trained on lactation counseling or breastfeeding support training, who report an increase in knowledge and skill around breastfeeding practices, and then also the number of calls that come in to the state breastfeeding helpline. And lastly, in our adolescent health domain, we have measures or strategies in place that help us to track the number of schools implementing bullying prevention guidance, the total number of youth served by an organization trained on mental health first aid for youth. So these in particular are strategies that focus on mental health within our Title V block grant application that we submit every year. We have these strategy measures outlined for each population health domain as they relate to the national performance measure. So for us, this is very specific to our mental health strategies and activities. This does not limit the activities that the department, so not just within our bureau, but the Department of Health Services. We have a wide range of strategies. The ones I'm focusing on today are those that are funded specifically through the Arizona Title V MCH block grant, but the Department of Health Services and our Bureau of Women's and Children's Health have other funded strategies as well that also align with these Title V strategies. I also, on the next slide, wanted to share some highlights of 2021's activities. So our 2021 activities related to our Title V mental health related strategies. So as a result of us implementing through our contracted partners, through our county health departments, and through our Department of Health staff program managers have been able to achieve some of these outcomes. And so in 2021, we were able to serve over 400 clinical and non-clinical professionals that participated in our maternal and infant mortality summit. We had 70% of mothers enrolled in home visiting programs who received postpartum visit with a healthcare provider within 60 days of delivery. We had over 21,000 youth served by an organization trained on mental health first aid for youth. We had over 45,000, close to 50,000 home visits completed across our Department of Health Services funded home visiting programs, and that includes our McV funded Health Start and our high-risk perinatal health programs. We also have about 84% of children enrolled in home visiting who received a referral for the development services and have a completed referral. So just wanted to point out that our teams and our partners work diligently to move our strategies forward and work with many of you to be able to impact the health and wellness of women, children, and families in our state. Next slide. In the final slides, I just really wanted to highlight some of the media campaigns and activities funded by the Title V block grant. Yes, next slide, thank you. To start, all of our campaigns, in particular to this presentation, address mental health across the population health domain. So these activities are meant to engage the MCH population with mental health concerns and connect to resources, also intended to address and reduce shame and stigma. Some of the recent activities focus on addressing substance abuse, postpartum depression, and NAS outcomes. So the Know the Signs campaign is one I wanted to share with you. Also, the information and how to access information is included on this slide. So in Arizona, almost half of all pregnancy-associated deaths between 2016 and 2018 were related to mental health conditions or substance use disorders. So we, in looking at this data, decided that we were going to work together with partners to put together a campaign. So there's been a lot of work towards the perinatal mental health in Arizona, and this work has been done before and continues on through this campaign and in many other efforts. So this specific funding was a collaboration across state agencies, community partners, and funding streams to be able to support this initiative here in Arizona. The Know the Signs campaign really focuses on the mental health conditions that occur in parents of every age, race, culture, and income level, and also helps to target professionals, loved ones, and birthing people to know the signs, to get the support that is needed of all birthing individuals in Arizona. Next slide. Our Hope Heals campaign is a campaign that targets pregnant and postpartum women. The See Me Differently campaign targets providers. So we're kind of doing a dual campaign that focuses on both the pregnant postpartum individual and then also the provider, as we know that those campaigns will be able to support the work that needs to be done for those populations. This Hope Heals campaign is able to focus on reducing the stigma associated with pregnant and postpartum individuals with substance abuse, and the campaign is running through June 2023. Both of the campaigns, the the See Me Differently and Hope Heals campaigns, are both focused to reduce the stigma associated with pregnant and postpartum individuals with substance abuse. Next slide. Wanted to touch on the Maternal Health Innovation Program and the work that has been done over the last year regarding perinatal mental health through the partnerships created in the Maternal Mental Health Task Force, ADHS, community partners, and other state agencies all coming together to elevate this important issue. This group focusing on maternal mental health through an advisory committee that was established in State Bill 1011. So members of the task force were part of the Maternal Mental Health Advisory Committee. The priority areas developed by the task force were leveraged in the work, and final recommendations were put together in the Maternal Mortality and Morbidity Action Plan. The perinatal psychiatric consultation line is real-time consultation, education, and care coordination for providers. At the beginning of 2002, the task force and ADHS both pursued interest in bringing this to Arizona and brought subject matter experts to talk about implementation and outcomes. All of the right people were there to be able to have the discussion, and partnering with Access and the University of Arizona to launch the Arizona Perinatal Access Line, hopefully by the end of June of 2023. Workforce development, that ongoing training is the continued partnership with Postpartum Support International, continuing training and certification of maternal health providers across our state. Perinatal mental health is a specialty, and additional training is needed. Next slide. We also have the ability to partner with through our maternal health work with tribal partners to have a very specific discussion around our tribal communities. And we do this through the Maternal Health in Arizona Tribal Nation. So this is a very specific tribal maternal health task force. So the priority areas and themes that are focused on here are professional development, access to care, integrated, coordinated, and systems of care, community unity, and data surveillance. So we work with Dene College and the Intertribal Council of Arizona to be able to collect data and inform the work of the Tribal Maternal Health Task Force. This is a dedicated group of individuals that meet consistently to be able to bring together the information and improve across 4 priority areas. So the very specific priority areas are improving access to and early participation in prenatal care, increase patient and provider awareness, and also focus on tribal leaders and non-tribal public health work to improve surveillance data with tribes. Next slide. Other just kind of quick plugs for some of the other campaigns that are MCH related within the Department of Health Services. So our Strong Families AZ home visiting in partnership with our Office of Injury Prevention and Department of Child Safety, focusing on safe sleep campaigns. Our Count the Kicks campaign, which is a stillbirth prevention campaign, is currently running in partnership with Count the Kicks, a national organization. And then also just additional campaign material for our maternal health campaigns. Next slide. And just to kind of wrap up and be able to share a little bit of some of the work that we have upcoming, and is August 23rd, 24th, would like to invite everyone and bring awareness to our annual Maternal and Infant Mortality Summit. So save the date, and we hope that you will be able to join us, and we will be looking at having registration open May 15th. And with that, that ends my presentation on the Title V MCH block grant and our activities within the state of Arizona. I would like to thank you for your time, thank the team for the invitation to share this with you today.
Thank you so much, Laura. We have, I think, some questions popping up in the Q&A, so I can kind of lead that. So let's see. So from Maria, she asks, is any funding from Title V grant going to advocating for policies that will support mothers and their children? For example, paid maternity leave, affordable childcare, or sick time?
So great question. We do not use specific Title V funds to fund policy work, but our goal through our Title V partnerships and activities, specifically those that I shared today, so the partnerships with Access, the partnerships with our tribal partners, so indirectly through these activities and strategies, we are informing the work that will impact policy. And while we do not have direct funding that goes to policy, we are able to partner and participate in discussions and bring together, so convene groups where we're able to bring forward that Title V needs assessment data to inform that policy, and also to inform the work that our partners that are able to engage in that policy work, so that they have what is needed to move forward. So the Title V block grant in particular serves more as a convener in the area of policy support, if that makes sense.
Thank you. And I just realized I got overly excited and I was supposed to pass the Q&A over to Kiera. I'm so sorry, Kiera. If you want to take over, I'll let you take the reins.
Not a problem. The next question was, what opportunities are available for partnerships with your Bureau for researchers?
I would say that the best opportunity to partner in regards to our maternal and child health related surveillance and or epidemiology will be through our Bureau of Assessment and Evaluation. Anyone is able to reach out to myself as the Bureau Chief and MCH Director, and I'm happy to connect individuals with our Bureau of Assessment and Evaluation so that we can connect projects or activities that would be useful for those that are looking to partner with the Department of Health in MCH related activities or data surveillance or activities.
Thank you. The next question is, next comment was, good morning. I cannot thank you enough for your team's leadership and dedication to maternal and child health. The work you are doing is groundbreaking and will directly impact the maternal and child diets and family triads. We are looking forward to future work and collaboration.
Thank you so much for that comment, and thank you for the work that you're doing as well.
The next question is, that's more asking about the chat box. Next question is, do these programs reach out to people with commercial insurance or are underinsured, or just those with Medicaid?
Yeah, so the Title V block grant activities are open to all individuals in Arizona, regardless of health insurance status. We do in many of our programs, specifically speaking to our home visiting activities and other kind of community health work, do inquire about health insurance status to ensure that our families are insured and are connected to resources to get them insured if that is what's needed. But our Title V block grant activities and programs are open for all Arizonans.
And if anyone else has any additional questions, please feel free again to add them to the Q&A box, and we'll be happy to let Laura know what those questions are. I just wanted to ask a question myself. Just, would you be willing to just talk a little more just about the community involvement in regards to, in the lessons learned in regards to the, prioritizing the different, framing your priorities, framing your priorities in regards to needs assessment, just get a better understanding of the community involvement in that and how they helped, shape that.
Yeah, absolutely. So going back to the specific slide where I addressed the Title V needs assessment, one of the best ways is to kind of go back in particular to look at the stages that the state MCH block grant team moves through that needs assessment planning, implementation, and monitoring. So the specific areas that where we are able to engage with community partners are from the very beginning. So we have that external steering committee, as I mentioned, that's made up of external community members, so not ADHS staff. And so that's one of the main areas where we have that initial kind of connection to that community voice and to that lived experience to be able to inform that needs assessment process and also to help frame the priorities. We also have focus groups that are held as part of that needs assessment process where we're collecting information specifically around those health issues, concerns at the local level. So we will have our teams travel to, Yuma. We will have teams travel to all parts of the state in southern Arizona and northern Arizona to be able to help us engage with families that live in their communities to be able to help provide some additional insight. And we work with contracted partners to be able to carry that out, and specifically with our tribal needs assessment team to carry out those focus groups in our tribal populations. Another area where we look to engage consistently for priority setting is through our county health departments. So as a state health department, we have the primary partners within our county health public health teams, and those county health departments and public health teams also are part of this planning and design, and also helping to inform the needs assessment priorities, the Title V priorities on an annual basis. And I'm so sorry. The one last component that I am failing to mention because it's not in on a note in front of me, but just came to me, is that we do have a public comment period, so public input period on our Title V block grant application, which is posted on the Arizona Department of Health Services website, and is distributed among our contractors. So we will have our program managers distribute to all partners, both internal and external, to be able to provide any input on our Title V block grant, so that we can also receive and collect any feedback and input throughout the year to help inform our next or our following year application.
Awesome. Thank you so much. The next question we have from our guest is have you seen a decrease in adverse maternal outcomes with the extension of home visiting services?
So we do have our home visiting data that where we are able to see those areas that we are impacting most. I do not have the very specific data sets in front of me, but what we have seen is an increased number of home visits over the course of the last couple years, because, you know, while we thought we were going to have some run into issues with the pandemic in reaching families, we were able to actually engage families virtually at a higher rate than we were able to in person. So we've been able to navigate those specific barriers by the implementation or adding the implementation of a virtual visit. So we've been working diligently to be able to have that ability to both meet with families in person for those very specific visits and also meet with them virtually. But we have seen some improvements in the areas of connecting with families, and also have seen some improvements in health outcomes that are available through our state-funded programs, but also through our MCV, our Maternal Infant Early Childhood Home Visiting Grant, does produce a benchmark report every year. And so that's also a resource that I can share, where we can be more specific and share some more specific improvements in health outcomes as a result of home visiting.
Thank you. Next is more of a request about providing your contact email again. I would like to get some more information about the August meeting.
Yes, of course.
The next question we have is, how were you able to build trust to engage with the families?
So I think that we utilize different strategies, as I'm sure many of you are aware, to be able to work with individuals. We have first and foremost, we work with contracted individuals that work in those communities. So I would say that that's one of the strategies, is we're working through our contracted partners, so that trust isn't necessarily directly with the health department, but it's continued trust and with those that work and live in their community as well. That would be, I think, our biggest our strategy that's implemented the most, is working through our ongoing and existing partnerships. So not introducing ourselves as the leads to collect that data or that partnership, but working through partners that are part of the community that already have those established relationships with families.
Thank you. Do we have any other additional questions from our attendees? Again, please feel free to add those to the Q&A box.
I'll just go ahead and ask a question. So at one point in your presentation, you were talking about the like the evidence-based or evidence informed practices that you're kind of leveraging in working towards, you know, the goals that you've set. And I just wondered if, because that's kind of our like role as a university to help define or expand the types of things that we know work. And so I just wondered if there were any specific gaps in terms of evidence-based interventions that, where you're looking and saying, we really need to address X, but there's just not enough evidence about it. And so it's a little bit hard to, put something forward. Have you noticed any gaps like that?
Well, I would love to be able to say that I can answer that question. I am sure that there are gaps. I can say that that's a conversation that we have every year. I would definitely say that Martine, who leads our needs assessment work and really kind of does that deep dive within that data and that ongoing monitoring of that data, I would say would be able to provide that information. But I would say, as far as evidence-based strategies, I mean, I guess I could answer the question more in some of the areas that we're seeing gaps from a programmatic perspective and a fiscal perspective, meaning where we don't see a lot of, where we've seen a changing in funding is more in the oral health screenings for children. So I would say for children, for pregnant women, for children with special healthcare needs. So across population health domains, I would say that's a gap that we continue to see, specifically tied to your comment or your question around strategies. I would say that we could probably reach out to Martine and he can look at that, but I would say we look at it more in terms of where are the gaps in regards to access to services, access to care.
Mm-hmm.
And for us right now, a lot of that is oral health screening and the funding around how to support that, not just through the Title V block grant, because the Title V block grant is not intended to fund every component. As you know, $7.4 million is a substantial pot of funding, but it is not the largest pot of funding that the Bureau of Women's and Children's Health receives. So we really do have to partner and try to leverage funding to be able to meet those gaps. So I appreciate your question, and I'm happy to follow up on that specifically in regards to strategies as well.
Great, thank you.
Mm-hmm.
Laura, I also had a question. The Know the Signs campaign and the Hope Heals campaign sound really interesting, and it looks like you have a robust set of ways that you can reach your audiences. I was curious how you split up and implement your outreach to meet the needs of providers versus mothers.
So I can say that those decisions were made within kind of the task force, right? So in collaboration with partners, those were items that were part of the discussion as they were building out the components of that media campaign. Is what do we need to know? What do we want the message to be for providers, and where do we want the focus to be on for individuals? So I think it was really important to be able to make that distinction, which is why 2 campaigns ran as opposed to just funding one. And so I really applaud the group that was working together to be able to make that happen, and to be able to advocate that we really needed to focus on 2 separate population or groups to be able to meet those individuals in their day-to-day practice, or in their kind of where they're at in their life or in their journey in regards to substance abuse addiction. So really, those stigma reduction campaigns are newer to the department. Again, they're not the first time, but it has been some time, quite some time before the department has kind of funded those campaigns. So we will be continuing to run that campaign until we are able to, continue to see some outcomes as a result. And so Angie Lorenzo is our contact for our Office of Women's Health, and she has done a really great work along with her team, Heidi Christensen and Lynn Lane, to be able to bring together and convene those partners through not just Title V specifically, but also our Maternal Health Innovation Program, and also through our Maternal Health Grant funding that specifically targets, more of that maternal women's health and wellness strategies and activities. So it's really a partnership between federal funding.
Thank you.